Hello everybody, this is Health Boxes and this program is on breast cancer awareness and it's been sponsored by Friends of Health Boxes and Aid Consulting as well as Canamed Clinics. Canamed Clinics, you can find them in Ogudu, 137 Ogudu Road, and that's where we're here today. And we're here with Dr. Annie from an Aid Consulting and Moms 24. Yes, Moms 24 is her alter ego. So if you want to get to know Dr. Anne more, just check out her on Moms 24. And so Health Boxes is a telemedicine service, and on Wednesdays we offer free calls to speak to a doctor on diabetes, high blood pressure, mental health, sexual health, sponsored by Friends of Health Boxes as well. So we're going to dive quickly into breast cancer, where this is October. October is Breast Cancer Awareness Month, and so we've had a campaign. We've screened about 12 women here in Ogudu.
And we hope
today.
to still do some
Yes,
more
and we're
before
hoping
we
to
leave.
do some more before we go. And so we'll be asking. So Dr. Anne is going to educate us on breast cancer, and we have a few questions that we would like to ask her based on feedback, and some of them were already asked earlier on in the session. So can you tell us just briefly about breast cancer and its effects on the body, both male and female? So what signs to look out for? How does it manifest?
So breast cancer, first let's talk about what it is really, before we talk about how it manifests. Breast cancer really is, first let's talk about cancer. What is cancer? Because a lot of people really get confused as to what cancer is. Cancer are parts of the cells of the body that are disrupted, maybe abnormal cells. Well, the best way to describe it is to say that they are abnormal cell development of any part of the body. And these cell developments or these mutated, disrupted cells are meant to die and be absorbed by the body. But when they are not absorbed by the body, they are defected and they continue to grow in that part of the body, then we say they are cancer, because then they continue to grow and they feed on the normal cells of that area. And in the case of breast cancer, that is what has happened. And so abnormal cells that are not healthy are growing, and then they are eating up the normal cells of the body in that area, and then they can then go on to spread to other parts of the body, which in medical language we call metastasis. And so that's what cancer is. Now, you asked what causes, breast cancer.
Yeah.
Now we know that we don't really know what causes breast cancer. Science hasn't been able to say for certain what causes cancer, or breast cancer or any other kind of cancer. But we know that there are certain risk factors associated with cancers and cancerous growth. Now in breast cancer we call them modifiable risk factors and non-modifiable risk factors. The modifiable risk factors are the things that we do that can increase or reduce our risk, while the non-modifiable are the things that whether we do, there's nothing we can do to change it. And those are the most important ones: age and sex. So the number one risk of developing breast cancer is being female. If you're genetically female, you're more likely, there's more than a 99% chance of a female having breast cancer. Of cancer, or breast cancer occurring, if you're not a female having breast cancer, of breast cancer occurring in that individual. So having said that, female being female, gender female, then the second thing is age, because as we grow older, our cells are always regenerating. And so there's a lot more regeneration going on as you're growing older. And so increasing age is another risk factor for breast cancer that we can change. I mean, we all want to grow older, don't we? We all want to grow older. So those are things that you cannot change. Now, for the things that we can change, number one is smoking. Smoking, we know that it introduces a lot of toxins into the body. And these toxins can cause destruction of cells. And that's why we say they can cause breast cancer, they can cause all the types of cancers, they can cause all the types of diseases.
So does this include vaping, for example?
All forms of smoking, whether you're
Weed.
smoking weed, whatever it is, as long as it has toxins in it.
Hashish.
In fact, some of them have been
I
noted
think
to
it
even
would
be
be
worse
than normal cigarettes.
than normal
right?
cigarette smoking. And we know that vaping is causing a whole lot, because it's relatively new, it's causing so many other problems now that are coming to the limelight. Having said that, smoking, and then in the same line, excessive alcohol intake, because of course to some degree it can also cause cell disruption. And then there are also other factors. We have excessive hormonal factors. Some of them include excessive hormonal exposure. So they say that for women who attain menarche is first first menstrual period that you get. So that's menarche for those who have it very early, before they are 10. And then for those who early menarche and late menopause. So we know that the usual age range for menopause is between 48 and 52. So for those who are still having their periods still late in their 50s, they are also, because why? Again, is the action of estrogen. And
I was going to say that, can you link, how does the hormones link into breast cancer?
Because again, for the treatment of breast cancer, we have, they say, some of them are estrogen positive or have estrogen receptor positive.
Do you guys know the hormones? Are we talking over your head? Ask questions too. So my job here is to try to make it less medical, So, so about the hormones in the body and how it regulates menstrual cycles.
Which are usually the estrogen and the progesterone. Yes.
Yeah. So it's actually the levels of those that predisposes us to breast cancer.
That is when their levels are more than usual. They can then, it's a risk for, not that they cause it, it's just a risk factor if the levels are more than usual. And that's why things like oral contraceptives, the combined oral contraceptives, have also been known to be risk factors in addition for the treatment of menopause. For the treatment of menopause, there's been a lot of scientific study that says that it's not, for the levels that are given to patients, is not a risk factor for breast cancer. But the main thing that we should know is overexposure to these hormones can predispose or can be a risk factor to breast cancer. Having said that, there's also the genetic factor that is for first degree relatives. So it's said that if you have a sister or a mother, or if you've had a daughter, or you have a daughter who has been diagnosed with breast cancer, there is a chance, almost up to 25% chance of breast cancer occurring, in the family for all the females or any of the females.
So what would you then now recommend to that family?
And so usually for people, for females and males, because we know that up to 1% of breast cancer also occurs in male. What we do recommend is that you start screening early. And so aside from knowing how to do a self-breast examination, ensuring that at least twice a year you go to your doctor for a clinical breast examination. And then again, we're talking first degree relative risk, to start all of our investigations, like the mammograph. Now, usually mammograms are recommended for women or for persons 40 years and above. But for people who have a first degree relative genetic factor, you're actually encouraged to have it at least 10 years before, and so 30 years. Or some people will say the age, if for instance a mother was diagnosed at age 43, that means that you by age 33 should be having mammograms done every year. So those are some of the risk factors.
So why the mammograms?
Because the mammograms, now for me to talk, the mammograms are an x-ray of the breast. Now the mammograms are able to pick things that you may not be able to pick. Now we talked about, before we started the recording, we talked about some of the signs maybe we should talk, maybe after this we should talk about the signs and
Yes,
symptoms
that's
associated.
one of the questions.
So the mammograms, because the usual sign, the most common sign for breast cancer is a lump. However, some people never have a lump, and these things are picked up, or they are not able to feel or palpate a lump during an investigation. Even the doctor.
What is palpate?
That's when you are touching. Like we taught about how to examine the breast. So this process of touching and examining is what you call palpate. All right. So if you miss it and you're not able to feel it, the mammogram will then catch it. And so the mammogram helps to really, it goes through, and then the ones that we have around is 2D. We have other, we have the 3D now that, they're still working on and all, but that's able to see even more. But it's really able to see inside the cells and pick up if they're, as from the tiniest deformation, it's able to find, early signs of breast cancer. And then further investigations can then be done if there is a need for a biopsy to know the type of cells that it is.
What is a biopsy?
A biopsy is taking a sample from whatever lump or mass that was seen in the breast. So that sample will now be checked by a pathologist. And that sample, then from that sample you can know if it is a cancerous, what's it called now? If it's a cancerous lump, or if it is benign. Benign means that it cannot go beyond the breast and cause damage and cause death to the breast or go to other parts of the body. So it's just going to be there. You can just remove it and leave the other parts of the breast there. However, if it is a malignant one, and depending on the type, because even when it is a malignant, or if it is a cancerous one or a malignant one, there are different types of cancers. And the biopsy will tell us what type it is and what type of treatment, along other things, need to be done, whether it will only be surgery or surgery and chemotherapy, or if radiotherapy is going to be done, or even immune therapy, hormonal therapy. So there are so many types of management. So doing a biopsy will help us know exactly what type will work for that type of tumor.
So what are some misconceptions around breast cancer?
Misconceptions. There's so many misconceptions. A lot of people, some people think that wearing underwire bra, the one that we call posterior bra, that they cause breast cancer. Some people think that yes, when you wear tight bras, it can cause breast cancer.
We had a question about dirtiness. If being dirty causes breast cancer.
So all of these things have their own effects on the breast. For instance, wearing very tight bras, it's going to be uncomfortable. It's going to give you marks that over time you don't want. You don't want markings on your breast. Those are not the things that cause breast cancer. If you are dirty, it can cause, yes, it can make you prone to infections. Yeah, it can make you prone to swelling that are not associated with breast cancer. So those are not the things that cause breast cancer. That's why we call them myths, we call them misconceptions. Some people have said using roll-on will cause breast cancer. But again, it's been proven scientifically that antiperspirants, deodorants are not able to cause breast cancer. What other preconceptions? Do you guys know of any? Some of the things you hear about breast cancer. Some people, I've heard people say, oh, if you've had a lump in your breast and it's been removed, you can't have breast cancer.
Okay.
But you can. That's why, like we said before, it's a continuous process of you checking. You have to always check your breast. You have to always check your breast. Yes?
Can cream also cause breast cancer?
No, it cannot. But what type of creams? What creams are you talking about? If we're talking about hormonal creams that have estrogen, progesterone in them, and you are overly
those bleaching cream?
So that's what I'm saying. Some of them
toxin things.
Yes, we know that those they may cause toxins in the body, but we know what do we know that can be precursors to cellular damage? We never know. So best thing is just avoid anything that is toxic to the body. So we talked about smoking, cigarette smoking, taking hard drugs. Those things can cause cellular damage. And the cellular damage can crop up in any part of the body, so it's best to avoid them. But generally, we know that being dirty, using antiperspirants, using deodorants, we know that they don't cause breast cancer. They've not been proven to cause breast cancer. Even putting money in your bra, putting your phone in the bra, we've known that those things are not risk factors for breast cancer. But we know that they are not things that we should be doing, because when you put money, that money has gone to so many places. You see how some people handle money. If you know how some people, sometimes I don't like to, because and then when I touch, I wash my hands, or I use what? Hand sanitizers immediately, because COVID has even made us more aware, of need for of germs and all of these things. So that's not the place to put your phone. Your breast is not the place to put your phone. In fact, the heat of the phone can cause sores, on the breast. So those are things that we shouldn't do. It's a no-no. Another thing that I've heard people say is that when you are fat, it causes breast cancer. No, it's not. It's not. Obesity is a risk factor for breast cancer, really, but it is most significant when the obesity comes after menopause. Why? Because we know that after the ovaries start producing estrogen and progesterone, fat cells also begin to produce estrogen. And the more fat cells you have, the more likely you have more estrogen produced than is needed. And so it can be a precursor, a risk factor in breast cancer. And we talked about the genetic factor, right?
Yes,
we talked about the genetic factor as well.
Yeah. So, but we haven't talked about signs and symptoms.
Yes, so signs and symptoms, what are the things that we should look out for, or that we can see, or people who have had breast cancer, what are some of the common ones? Because there are still some things that we may not be able to cover, but the common things that we see. First is the most common one is the lump, where you see a mass or a solid, whatever type of mass in the breast that wasn't there before, that is not part of the normal breast morphology like we learned earlier today. However, for some people, they never find a lump. The cancer is already occurring, and unfortunately for some, it spreads because they don't know, because they are, we have, like I mentioned at the beginning, that the anatomy of the breast, the morphology of the breast, the anatomy of the breast, there are different parts of the breast. There's the fatty tissue, we have the muscles, we have the muscles that are over the rib cages, then we have the fatty tissue, then we have the lobes, the lobules, and then we have the ducts. So there may be cancers growing in the ducts that may not be detectable by palpating and touching your breast and examining your breast. And that's why a mammogram is always recommended you do a mammogram, because a mammogram can then pick it up, especially when you're over 40 or when you have a high risk of cancer. So one, lumps. Now, having said that, there are other things. If when you are looking during your examination, you find that there's a distortion, one breast is, we know that usually one breast is a little slightly bigger than the other. But if you see a massive, not massive now, but an unusual distortion in the shape or size, a change in the shape, a change in the size, that is not associated with, of course, breastfeeding, and is not associated with your menstrual cycle, your menstrual period, then you want to check again, or what is causing this? And then it will also prompt you to do a proper check by palpating and checking. So a change in the size, a distortion, a change in the shape of the breast, one of the breasts or even both of them. So if you are used to knowing how your breast looks like and how it feels, it's easier, because when there is a change, you will know quickly, because you know the normal, and then you can pick out what is abnormal. So a change in the shape or the contour of the breast. And then we go to the skin around the breast. What are some of the changes that can happen? There can be a thickening of the skin around the breast. There can be flaking of the skin, dryness of the skin. There can be puckering. There can be...
What does puckering do?
Puckering and dimpling. What we call peau d'orange. If you take an orange, remember when you have an orange, the skin, it has like dots. Those things, we call it peau d'orange. Now, a breast that has a problem, that has a tumor in it, that may be cancer, may have that change, depending on the stage. So if you see something like that, that's cause for concern. If there is a sore on the breast, any part of the breast, If there is swelling, it doesn't mean there's cancer, but then that means that there is a need to have that investigated, to have it checked by a doctor. If there's swelling, leaking. So that's when we get to the nipples. But so for the main breast, all of those changes are cause for alarm. For some people, tenderness. The tenderness, which is pain, is not usually a symptom of breast cancer. However, if the pain starts gradually and then it worsens over time, then it may be related to breast cancer. But any breast pain should actually go have it checked by your doctor. Then we now go to the nipple. Nipple, any change in the shape of the nipple. For instance, a nipple that is everted, that is out, if it starts going in, inverted, if it now goes in, it's a sign that something is happening there, something is drawing the nipple inside. It may be a tumor, so it needs to be checked out. If there is leaking of the, leaking from the nipples, or you squeeze the nipple and you're not a breastfeeding mom and it's watery or it's milky or it's smelly or it's bloody, is something that needs to be checked. Another important sign or sign may be swelling around the chest or feeling of a lump in the armpit, because remember, when we're talking about examining ourselves, we said that we have to check all the other areas where the breast drains, the lymph nodes, inside the clavicle. We talked about the chest wall, and we talked about the armpit. So any swelling around those places could be the lump, and so it needs also to be checked.
Is that why we're asked to raise our hands?
So when we're told to raise our hands, we're actually checking the contour of the breast. Okay. Because now when you do that, then you are also exposing the chest wall. The chest wall can then also, if there is a lump there or there's a swelling there, it can become visible. And then also the contours of the breast, you see them more clearly when you do that.
So what would you advocate is the best thing that people should do on both men and women on a regular basis to be aware, to be breast aware?
First thing, like we said, know yourself, know your normal, know your breast, examine your breast at least once a month. If you are not, the reason why we say once a month, so there's a timing to it. When there's a timing to it, then you are more, you may not forget. You can time it, put a reminder on your phone, so that maybe it can, for you, maybe you want to do it the first week of the month, last week of the month, middle of the month, or you want to do it before your period, or immediately after your period, if that is what reminds you. But what you must do is ensure that you know your breast, you are checking your breast, the look, the touch, and the squeeze. What we learned about self-breast examination. It's important. Know yourself. 2, clinical breast examination. Anytime you are ill, you come to the hospital, one of the things that you should tell your nurse or your doctor to do for you, please examine my breast for me. The way it's important that we check our blood pressure, we check our blood glucose, we check our blood cholesterol. This is also important that we do, because remember we said that when we started, we said that it is the #1 cause of cancer deaths in Nigeria, and it is the most prevalent cancer in the world. And then if for new cancer, breast cancer is also the #1 in the world, and even in Nigeria. And so it's an important thing that we need to be aware, because when we know, then we can prevent it. So we've talked about self-breast examination, clinical breast examination. The third thing is doing a mammogram. Mammograms are important. Why? Why are mammograms important? Because we say that sometimes you don't catch a lump.
Yeah.
And sometimes you don't see a lump.
Yeah.
But examination, the mammogram will catch it. And it is recommended that from age 40, women from the age of 40 should have a mammogram done. However, we also say if you are high risk, that means you have a first-degree relative who've had breast cancer or ovarian cancer, then you should ensure that you do it at least 10 years before the first relative was diagnosed, all right? Yeah. Or by the age of 30 for mammograms, right? And then we also know that for BRCA gene, BRCA gene 1 and gene 2.
Can those be tested?
Yes. genetic testing.
Yeah.
So for genetic testing, for people who have, very high history of, frequent history of breast cancer or ovarian cancer in their families, it's important that they have, if they are able to, they can afford to have genetic testing done.
Yeah.
It's because, again, for BRCA1, for people who have the BRCA1 gene, there's a 70% chance of breast cancer or ovarian cancer for them to develop. Lifetime risk, 72%. That's really high.
And
for
can
BRCA2
gene be removed?
I mean, those are
some of
your
the
core
developments
components.
that are
Those are your core components. So for now, there's nothing that can be done about the gene. So what can be done is prevention, and that's why you will find that some people will just go on ahead and remove their breast and have breast reconstruction and remove the ovaries because of having a 72% lifetime risk for BRCA1 and BRCA2, 69% lifetime risk of breast cancer. Those are very high.
Yes.
Yeah.
So, what treatments are out there for breast cancer?
For breast cancer, there are a number of treatments, and a lot of times, depending, like we mentioned before, depending on the type of cancer it is, that is what informs what mix of management that you get, or a particular management. So we have surgery, and surgery can be from just removing the lump if it's benign, or if it hasn't, if it's not sizable, if it's not if it's not something that, again, depending, we keep talking about the histology of the cancer itself.
So
on
histology has to do with the cells.
Yes.
And how the cells look.
That's when
and
you
how they
do the biopsy, right?
Yeah.
So from lumpectomy, removal of the lump, to mastectomy, which can be partial. Mastectomy is the removal of the breast or breast tissue, depending on whether it is partial or total or complete. So that's that. Then there's chemotherapy. There are different regions of chemotherapy based, again, on the cancer type. We have hormonal therapy. So depending on whether the cancer has estrogen receptors that are positive or progesterone receptors that are positive. We also have
when you say receptors, what does that mean?
That means that they are fed by the hormones, by either estrogen or progesterone hormones, if they add to the growth of the tumor.
So you just have a drug that blocks those receptors.
Exactly. So it's also a form of therapy, chemotherapy, or you call it hormonal therapy. And then there are also the monoclonal antibodies, the use of HER2 proteins. Yes, those are other things that also can be that are used for treatment. So it can be a combination. And then there is radiotherapy, of course. Where we have the radio rays that are targeted to the cells of that particular region. So
sometimes they combine.
Yeah, so it can be a combination of any two, any three, any four, depending on the nature of the tumor, and the classification of the tumor, and of course also if there is metastasis or there's no metastasis, because that also determines, the intensity or the intensity of the treatment.
So what would you advise someone that what other measures can they use to sort of prevent breast cancer?
So the measures to prevent breast cancers, we've talked about
or reduce their risk.
We've talked about the medical prevention in terms of self-breast examination, mammograms, clinical examination. Now we can then talk about lifestyle modification. And one of the first things I'll start with is to quit smoking. Because smoking, cigarettes, and every other type of smoking, because we say that those toxins can cause cell disruption. That is one. Two, excessive alcohol intake. Reduce alcohol intake. We should really be social drinkers. No, that means drinking once in a while. And then when you're drinking once in a while, what amount are you taking? So we have recommendations for how much alcohol that we must be taking, but we shouldn't always aim to hit the limit of the recommendation. We should
because
aim to go
they are
below
still chemical substances.
Yes, which can also cause cell disruption. So if you must, it should be in limited quantity.
So no binge drinking.
No, certainly no binge drinking because it does the body no good. No good on the short term and no good on the long term.
Yes.
So having said that, then we have lifestyle modification in terms of fitness, because we know that a sedentary lifestyle also encourages.
When you say sedentary,
if we're not moving, yes, if you don't inculcate physical activity, you're always sitting down for most hours of the day, and our bodies are made to move. And so ensuring that we engage in movement helps to, at least I think it helps with cell movement, I think, and then it helps with our lymphatic system, the ability for the body to drain. It's all of those things are interconnected.
Because yes, like you said, our bodies were made to move. But now, with the fact that we now work with the desk, or most times an average person is not doing more than 400 steps a day. So I timed myself yesterday. I didn't walk, and I only did 400 steps.
And that's why it's nice that we have all of this data, because it helps me also to look at, to see how much I'm doing. It's very easy for you to, even if you don't consider yourself as sedentary, you don't know until you're monitoring it. So ensuring that we are moving. I mean, WHO recommends up to 150 to 300 minutes of moderate to light exercise in a week, and up to 75 to 150 minutes of moderate to severe or high intensity high intensity physical activity.
So you can just decide you're going to do high intensity 15 minutes every day.
And you just cover up to 75 minutes, and that is good because and then it beyond reducing your risk for cancer, breast cancer, it also reduces the risk for other diseases, hypertension, hypercholesterolemia, diabetes, and all of that. So that's that for lifestyle modification, ensuring that you eat a healthy diet, so that, because we also know that obesity, especially when it happens after puberty or during puberty, and again after menopause, can also be a risk factor for breast cancer. So those are ways of limiting
our risk with that. So if someone out there has a friend or family member that has been diagnosed with breast cancer, what would you advise the best kind of support to give would be?
Right, so I would recommend that,
what resources?
That the best kinds of support are three tranches. Not three tranches now, 3 ways: financial support, mental support, and spiritual support.
Okay.
I mean, we are all spiritual beings, aren't we? So I find that is important. A lot of people think that the spiritual support is the only thing. It's the only prayer is I'm praying for you, I'm praying for you, but that's not the only thing. Prayer is good because from research shows that when
you have faith,
that it helps in recovery. And I think that when you have hope in something bigger than yourself, especially when you're down and you feel out and you think that there's a possibility that nothing is going. Having that faith really does a lot to our mental health and helping you to fight. But cancer is a very expensive diagnosis.
Yes, it is. So even with the expense that you have to deal with, it can get you down thinking of where to find, and the fact that most of there's no support, HMO-wise, governmental-wise, everything is private. It's private.
Even for the government hospitals, you still have to pay.
You still have to pay.
And they're expensive.
It is an expensive disease.
It's an expensive disease. So as much as you can help financially, and I would believe that they wouldn't think that anything is too small. If you can't give financially, help around them. Help to solve other problems that they may have. Run errands for them. You can also come together and do research on the facilities that are available, where you can get the best care for the best best care at the right amount that you can afford. Yes, and so all of that helps. being with them, helping them know that they are loved, that they are cared for, that they are important in the scheme of things, can help to boost their mental health.
Yeah,
Knowing that, so those are ways that we can help, and then we have information about how they can seek help, how they can be better, good information, and not telling them that going from one religious group to the other, or just going on herbal therapy that are not scientifically proven to work. Those are not the type of help we're talking about. Things that would help to uplift them, how they can get the best care, linking them up with resources and with medical amenities that will help to solve the problem.
So someone that's trying to do that research, where would you advise them to go first?
In your locality.
Yeah.
I would say, everyone says, oh, Dr. Google has resources, yeah. But some of the resources may not be tailored to your environment.
Yeah.
So go out in your environment, check. A good place to start from the government hospitals.
Definitely.
Start from the tertiary hospitals, the teaching hospitals, the general hospitals, the federal government hospitals, yes. And also we have specialized hospitals that may also be private or government owned. We have cancer centers, and some cancer centers even deal with particular types of cancers more than others. So do research, ask around, Google, look for Google and add your area, your location also to it.
Yeah.
And then speak with other people who have had cancers. It doesn't have to be breast cancer.
Yeah.
And find out how they were able to deal with it. So no one is an island, right?
Yeah.
But when it comes to cancer is a multifaceted type of care. There's so many other people involved in care. It's not one doctor. There are several other doctors we have the surgeons, we have the oncologists, we have the physiotherapists, we have the nurses. We have so many people involved in
care.
Yes, in the care.
And that's part of what makes it expensive.
Yes.
So to round up the talk, why are you advocating for the Think Within in October? You personally, Dr. Anne.
Because early detection saves life.
Yeah.
I've had personal experiences with people who are dear to me, not one person, people who are dear to me who found out that they had breast cancer, did what was needful, and were able to live through it and survive. They are here today, or have found people who have found lumps in their breast. I've also had people who are dear to me who have died from breast cancer.
Yeah.
For some of them, didn't get the type of care that they needed to have gotten for some reason or the other. For some of them who found out when it had too late.
Yeah.
And so, even though survival was to a certain extent, but it wasn't optimal as it would have been
if there was early detection.
If there was early detection. And again, research is showing us that it is, worldwide, it's the most prevalent cancer, both male and female cancers together.
Yeah.
It is the most prevalent cancer.
Yeah.
It has the highest incidence worldwide.
Yeah.
It is the second highest cause of cancer deaths worldwide. That is worldwide. Now in Nigeria, it's a triple whammy. It's highest prevalence in terms of highest prevalence of cancers, both male and female cancers, highest incidence, both male and female cancers, and highest cause of cancer deaths, both male and female cancers. So it's something that can be preventable.
Exactly.
And that's why I'm passionate about educating us about doing what we need to do to catch it early.
And then it's also cheaper when it's caught earlier.
Yes.
Yeah.
So that's it.
So I, as LSK from Health Boxes, would like to challenge everybody listening here to, I don't know, are we going to turn into a hashtag tell 7 people to check their breast, and we can share the training video so that we can actually, if every man decides they're going to tell 7 people, even if it's once a month, to go and get their breast checked, or watch the video on how to do their breast examination themselves, I think we'll be able to make a dent in this death burden that we have here in Nigeria.
And to add to what you say, the role of the men will say, oh yeah, but I have less than 1%, means we all have women in our lives.
Yeah.
We cannot underestimate the role a man plays. We all as men, we have mothers, some of us have sisters, some of us have daughters,
yeah.
Some of us have friends that are dear to us, and then some of us have wives. A lot of times, many a times, when a woman comes to the clinic and says, oh, I found a lump, her husband found the lump.
Yeah.
And so it's important that women as well know how to, self-breast examination is not for only men. So when we have sessions like this, we also invite the men to come.
Yeah, but they
learn.
never come.
Some of them come actually. I've had some
that have come.
Yes, but the importance is it, because aside from your own breast where the lumps can easily be found for men, it's not so for. So even if it's for your daughter you are doing it for, or for your wife that right in the midst of everything, you are also conscious of it, or you educate your mother, you educate your sister, you educate your friends, you enable them also to be educated, to also go for checks, then you are doing the right thing. Then you are also, enabling the pink awareness initiative.
Yes.
So you have your own role to play in all of this.
Thank you so much, Dr. Anne. Dr. Anne is one of the friends of Health Boxes, of course. And watch this space. We'll be taking on diabetes, grief. What else? This is for the rest of the year. HIV, and there's something else. Uzo. Anyway, just keep following us. Subscribe. Is that what you say? Yes, smoking actually. We'll be talking about that November, December. So subscribe to be able to hear more. And who knows, we might be in your neighborhood and you might come and meet us. Thank you and God bless.